Okay? Meaning it's a combination of the cerebrospinal fluid and some blood. However, after a few minutes, magki-clear out na yan. Okay, normal lang talaga na kapag kumuha ka ng sample ng CSF from the subarachnoid space, okay, medyo may red-red yan. Medyo nagpipink-pink yan. That's normal. Kasi nga, of course, humalo yung blood. Okay, humalo yung blood from the insertion site. But in a few minutes, it should clear out. If it doesn't clear out, then that suggests now possible subarachnoid hemorrhage. Okay, so normally your cerebrospinal fluid should be clear and transparent. Next. The normal CSF total protein, the number of your CSF total protein is about 20 to 50. That is about 20 to 50. Okay, it's about 20 to 50. 20 to 50. Okay, your gamma globulin, the normal gamma globulin, I will tell you later. We will discuss later. Sir, what if your proteins is increased? Pwede ka bang, does that suggest now possible diabetes mellitus? Mga ganon. We will discuss abnormal findings later. As of this time, we are still discussing the normal findings. So the normal CSF total protein is about 20 to 50. Okay, mg per dl, 20 to 50 mg per dl. Your normal gamma globulin is about 3 to 12%. That's about 3 to 12%. Okay, pag increase ng gamma globulin mo, that suggests now a possible the generation of the myelin sheath. Okay, we will discuss that later. Okay, so the normal gamma globulin is about 3% to 12%. Your normal CSF total protein is about 20 to 50. It's about 20 to 50. Your normal CSF glucose is 50 to 80. The normal is 50 to 80 mg per dl, 50 to 80 mg per dl. And the normal CSF cell count is that for red blood cells, there should be no red blood cells. There should be no red blood cells in your cerebrospinal fluid. If red blood cells are present in your cerebrospinal fluid, then that suggests now possible bleeding, cerebral hemorrhage, or even intracranial hemorrhage. Okay, there should only be about 0 to 5. There should only be about 0 to 5 WBC. There should only be 0 to 5 WBC. Otherwise, pag increase yan, then that suggests now trauma. Okay, it may suggest brain trauma. It may suggest a brain abscess or tumor. Okay, it may suggest a trauma-related edema. It may suggest a trauma-related edema. Let's go. Am I being too fast? Or it's just okay?
Okay lang po, sir.
Okay. If you could have it recorded, you may do so. You just play it back when you review. Okay, let's go. I repeat, your normal CSF glucose is about 50 to 80 mg per dl. Your normal CSF cell count, there should be no red blood cell count, but your WBC count should only be about 0 to 5. Okay, let's go. The presence of white blood cells in the cerebrospinal fluid is termed as your pleocytosis. It is termed as your pleocytosis. Okay, the presence of white blood cells in cerebrospinal fluid. Sabi ko nga, there is only about 0 to 5. Okay, 0 to 5 WBC in the cerebrospinal fluid. But if it is increased, then that may suggest possible infection. Okay, it may suggest a CNS infection. It may suggest a trauma, CNS trauma or a brain trauma. It may suggest a tumor or abscess. Okay? A small number of monocytes can be normal. Yes. Okay. It's special type of your WBZ, so a small number of monocytes can be normal, but a large number of granulocytes, guys, a large number of granulocytes may suggest now bacterial meningitis. It may suggest bacterial meningitis. Favorite board exam question: what particular communicable disease can be diagnosed or determined by lumbar tap or lumbar puncture? The answer would be meningitis. It is the most definitive diagnostic test for your meningitis. It's the best diagnostic test to determine for the presence of the microorganism in the brain, okay, in the CSF, okay, and that would be your lumbar tap. I repeat, a large number of granulocytes may indicate bacterial meningitis. We will discuss. Please paki-remind niyo ako na I will discuss meningitis after all the slides have been discussed. Please remind me later. Let's go. White cells can indicate, sinasabi ko na to sa inyo kanina, sabi natin 0 to 5 white cells are just normal, but when they are present, they may indicate a CNS infection. It may even suggest trauma. It may suggest a lesion or an abscess. When erythrocytes, your red blood cells, are detected in the CSF, sabi natin, there should be no red blood cells. There should be no erythrocytes in the CSF. When they are present, then that suggests now a subarachnoid hemorrhage or your intracranial hemorrhage. Your pink blood tinge or grossly bloody CSF may indicate subarachnoid hemorrhage. I repeat, for your pink blood tinge or grossly bloody CSF may indicate a subarachnoid hemorrhage, or bleeding. Pag sinabi kong subarachnoid space, guys, nandoon yung ating CSF. It is the location of your CSF. Okay? Your subarachnoid space regulates the environment. Okay? It regulates the environment in the brain. It regulates the environment in the brain, and it is where your CSF is produced. Okay? CSF chloride, the normal amount of your CSF chloride, is about 113 to 180, 113 to 130, I should say, guys. 113 to 180 mg per DL. 113 to 180 mg per DL. For your gram staining, there should be no microorganism. If bacteria or virus may be present, then that suggests possible meningitis. Because your meningitis could be bacterial or viral. So, gram staining, when you say gram staining, it is done in the laboratory. I do not know if you have actually done it. Okay? If you have done it in your microbiology class, in UP Diliman, that's what we do every day. In our class, in our bio class, in our chem class, we do it every day. So what we do actually is we get a sample of bacteria. Okay, it could be bacteria from your nose, it could be a sample from your nose, from your lips, from your eyes, and then yung agar-agar solution na nasa Petri dish, okay, ayun, pwede mong lagyan yon, pwede mong pahiran yung ilong mo, na ganyan. And then dun sa agar-agar solution na sa Petri dish, yan. Okay, and then sila nang bahala, iiwan namin. Okay, yung laboratory assistant, hindi namin alam kung anong ginagawa niya. Basta parang lulutuin niya. And then the next day, pwede na naming bilangin kung ilang microorganism nandoon. Or we get a sample from the Petri dish, ilagay namin sa isang glass slide, and then we add certain solutions, okay, and then seen over the microscope. Okay, kung nag-iba ang kulay niya, okay, then pwede mong ma-determine na o bacteria ito. Pag ganito ang kulay niya, o fungal ito. Kung ganitong kulay niya, okay, virus ito. Okay, I hope that anyway, wala tayong ganoon kasi nga pandemya ngayon. I hope that sooner or later you could also experience that. When you have your duty in your RHU, Rural Health Unit, they would allow you, okay, to do that. Kasi ako na-try ko when I was in fourth year, college already, in my BSN course, I was able to experience also what a medtech does kasi pinag-duty kami dun sa laboratory. I hope that sooner or later you would also experience how it is like performing a particular experiment involving your gram staining. So I repeat, your gram staining, in your gram staining, there should be no microorganism. There should be no microorganism. Otherwise, then that may suggest a possible bacterial meningitis or a viral meningitis. Abnormal findings, pressure for your increased intracranial pressure. Okay, for your increased intracranial pressure. So, kailan nangyayari ang increased intracranial pressure? Kapag ikaw ay may meningitis. Number one, kapag ikaw ay may CNS infection. Okay? Number two, okay, kapag meron kang cerebral edema, kapag inflamed ang brain. Pag may trauma, ayan, pag may trauma sa brain, halimbawa nabagok ang ulo na aksidente, yan, mag-i-increase ang intracranial pressure. Okay, what else kapag may lesion? Kapag may brain tumor, ganyan. Okay? Pag may brain tumor, kapag may recent seizure, kapag may recent seizure, yung mga taong merong convulsions, merong seizure episodes, yan mag-i-increase ang kanilang intracranial pressure. Sir, ano yung mga manifestations na pwede mong masabi na mataas ang kanyang ICP? Magko-complain niya ng headache. Magko-complain niya ng, the patient would complain of headache. The patient may complain of nausea and vomiting. Okay? If you would get the vital signs of this patient, you would notice that his BP is going up. His BP is going up. Okay? His RR is going down. His RR is going down. His pulse rate is going down. So I repeat ha, mataas ang BP. Mataas ang BP niya, mababa ang RR niya, mababa ang PR niya. And collectively, it is termed as your Cushing's triad. It is termed as your Cushing's triad. Kaya triad kasi tatlo, your BP, your RR, and decreased PR. You would also expect for the pulse pressure. What is pulse pressure, J-Lo? What is pulse pressure, J-Lo?
Sir, the difference between the systolic and diastolic po.
Okay, the difference between your systolic and your diastolic pressure. The normal is, J-Lo?
40, sir.
30 to 40. But in persons, in patients with increased ICP, you would notice that their pulse pressure is widened. Okay, more than 40 millimeters of mercury. Okay, so if you get the BP of your patient after an automobile accident and the patient is rushed to the hospital, if the pulse pressure is quite widened, then you would know that there is increased ICP. Pa-CT scan na yan. Okay, pa-X-ray na yan kasi bakit widened ang kanyang pulse pressure. Okay? So there would be, aside from this one, there would be restlessness. The earliest manifestation of increased ICP is your restlessness. You would expect for headache. The patient would complain of headache. Otherwise, he couldn't complain if he is comatose. Okay. Otherwise, you observe for restlessness, nausea, and vomiting. Okay. What else? The patient would also complain of photophobia. Okay. Louis, what is photophobia?
Fear of light, sir.
Fear of light or sensitivity to light. The patient would also complain of tinnitus. Okay. Nathan, what is tinnitus? What is tinnitus? Can somebody please help Nathan as to what tinnitus is? What about Carl? Myla Carl Sado? Ringing of the ears. Yes, Nathan, you are correct. Okay, so you would expect for ringing of the ears. Okay, so how would you intervene? How would you intervene in case of ICP? You have to position the client in semi-Fowler's or high Fowler's position. Okay, to relieve the pressure, to relieve your intracranial pressure, you have to position the patient to semi or high Fowler's position. Okay, that is to maintain cerebral tissue perfusion. You have to elevate your head, the head of bed, elevate the head of bed 30 to 45 degrees, 30 to 45 degrees, okay, to relieve your increased pressure. Okay? Additional information with regards to your increased ICP. We will discuss further of that later. Okay? Decrease the intracranial pressure. Kailan mag-decrease ang intracranial pressure? When there is increase in the proteins, increase in the CSF proteins, and in case of hemolysis. In case of hemolysis. What is hemolysis? Anybody? Magdi-decrease ang ating intracranial pressure in case of increased CSF protein and hemolysis. When you say hemolysis, that is your RBC breakdown. RBC breakdown or the destruction. RBC breakdown or the destruction of your RBC. The destruction of your RBC. I repeat, the medical term for RBC breakdown or destruction of your RBC is your hemolysis or hemolysis. Appearance, normally, di ba sabi natin, it should be clear, it should be transparent. But when it is cloudy, then it may suggest meningitis. When it is cloudy, that suggests infection or meningitis. When it is yellow to reddish, okay, when it is yellow to reddish, balikan nga natin to, guys. Decrease intracranial pressure. It indicates, pakipalitan nyo nga yun. Pakipalitan nyo yung sinabi ko. Very minimal lang yung ganon. Okay, very minimal lang yung unang sinabi ko about RBC breakdown. Pero ang pinaka-reason talaga is if there is when there is a spinal subarachnoid obstruction. When there is a spinal subarachnoid obstruction. Kailan ka nagkakaroon ng spinal subarachnoid obstruction? When there is a tumor or lesion. When there is a tumor or lesion in the brain. Pakipalitan nyo ngayon unang binanggit ko. Next. Kasi yung sinabi kong RBC breakdown, dapat sa brown to orange yun, guys. Sa brown to orange appearance indicating yan. Dito dapat yan. Anyway, ulitin ko na lang. Cloudy appearance, okay, it indicates now meningitis. It should be clear and transparent. But when it's cloudy, then it means the patient may have meningitis. Yellow to reddish appearance, that indicates now a subarachnoid hemorrhage. That indicates now a subarachnoid hemorrhage. Okay? Brown to orange appearance. Brown to orange appearance. Okay? It may suggest increased CSF protein. Ano? Guys, wait lang ha. Nakalabas yung malaki kong aso.
Sige po, sir.
Okay lang guys, wait lang guys.
Opo.
Meredith, men's room, make sure you replace the urinal cakes. They're worn down. Kevin, file drawers. Angela, kitchen. Oscar, dusting. Where is Oscar?
He's out sick.
That is unacceptable.
Ba't
I
parang
agree.
labo
It's
na?
unacceptable.
Nakikita nyo pa tong whiteboard ko guys? Hello?
Yes, sir.
Kita nyo?
Hindi po.
Hindi.
Puro
Wait
Hindi
lang.
po,
liwanag.
sir.
Wait lang. Mag-leave
Sobrang
ako.
liwanag.